Hi everyone, Dr. Jeff Ajazi here, checking in with another video on how to empower and educate you on common conditions that we see and treat in our office. Today, we're going to be talking about sprains and strains, what causes them, evidence-based approaches on how we diagnose them in our office, ways that we treat them in our office, and legitimate ways on how you can actually help yourself at home when you have these types of injuries. Sprains really references injury to the ligaments in the body. Strains references injuries to the muscles and tendons of the body. So a simpler way to look at it is that ligaments connect bone to bone and tendons connect muscle to bone. And depending on the mechanism of injury, the forces applied will determine the severity and the length of recovery for the sprain and strain. Common causes for sprain and strain are athletic injuries, overuse injuries such as yard work, slip and falls, and auto accidents. When it comes to getting an accurate diagnosis, it always starts with a good, thorough history. When it comes to sprains and strains, usually you're going to hear that there's a traumatic injury involved at the onset. Sometimes it can be a gradual onset, but not always. Usually there's going to be some sort of traumatic injury involved. If there's an injury involved, I usually like to ask if they heard a pop at the moment of injury. If there is, it could determine the severity of the injury and how long someone could expect to recover from that sprain and strain versus if they didn't hear a pop. We're always looking for red flags such as progressive weakness, numbness, tingling, or any kind of night pain that's waking them up at night. Once we've done a good, thorough, accurate history, then we're going to get into our exam. With the absence of severe trauma, we're not going to usually do imaging. So then we go into our physical exam and we're looking at range of motion, we're looking at strength, we're looking at active range of motion versus resisted range of motion versus passive range of motion. This can help us hone in on exactly what tissue is involved. Is it the muscle? Is it the tendon? Or is it the ligament? Once we've gotten through a good physical exam and we've come to a point where we're very confident that we're dealing with some sort of a sprain or strain, then we start looking at all of our treatment options. Of course, we're chiropractors, so if the chiropractic adjustment is involved or needed, we're going to incorporate that. But of course, because of the injury to the soft tissues, we're going to be doing soft tissue techniques such as all different types of myofascial techniques, cupping, scraping, even taping, which can help really support injured muscles. So when it comes to best practices at home on how to deal with a sprain, strain injury, there's been a lot of confusion over the years. That's really because the literature has changed over the years. Initially, we used to tell people when they had an injury that they needed to just rest and protect it. And they would rest and protect that injury for way too long. And in the short term, that helped people heal up from the injury. But the long term, it was not the best solution for those people. They continue to have a lot of chronic issues with their injuries on down the road. As science progressed, then we started getting into we need to move these injuries as people are working through these injuries. And we found out that with certain injuries, especially more severe injuries, the more you move them, you can really aggravate things, slow down healing, and sometimes even make things worse if you're progressing things too fast. So, just like everything in life, there's going to be a happy medium. The mnemonic to follow that can best follow the more evidence-based guidelines on dealing with a sprain and strain is a mnemonic that is peace and love. You break down every letter of those words, they have a representation. I will spare you the details of every single letter, but essentially peace references the first few days of the injury. So this chart right here illustrates the 3 phases of soft tissue injury and what your body goes through to heal those injuries. The first 2 or 1 to 3 days, you are going to have a lot of initial pain and swelling, and that's when you're going to want to stick with the mnemonic peace, which is essentially protecting that injury, using ice, not using too many anti-inflammatories that are going to suppress the swelling and inflammation since your body is trying to really assess the amount of damage. And so while your body is in those first few days of the injury, you're going to want to stick with and adhere to the principles of peace. When it comes to phase 2 and phase 3, that's when you're getting into love, which is more load progression, slowly integrating into movement and exercise to ease into those injured tissues so we can make them more tough and resilient for long-term benefit, so there's not going to be any long-lasting type lingering symptoms when it comes to sprain strain injuries. So if you're dealing with a sprain and strain and you're a little overwhelmed and confused on what to do, give Cassie a call or visit her website and schedule an appointment today.